Hey, everybody, I'm live for your questions. Great to see you here. Hold on just a moment while Hey, everybody, I'm live for your questions. Okay, always get that feedback. All right, so hello, everybody. Thank you for joining me today, this afternoon. It's a Friday here in Boulder, Colorado, and the weather is beautiful, sunny. The trees are still looking nice. But I know that's not going to be long because I think we're supposed to get snow soon and then the leaves will be gone. But I hope you're enjoying life and fall colors wherever this finds you. Please stop in, say hello, and be sure and tell me where you're from. And then, of course, put in your questions. I've got a few that were pre-submitted and I'll start with those in just a minute. But please, hi, Cindy. Hello, hello. Great to see you there. And anyone else who's popping in, just come in. Say hello, tell me where you're from, and get ready to ask away. I'm here for at least 30 minutes, maybe longer, depending on how many questions we get in, and would love to hear from you as far as what you would like to hear about, any questions you have about mold-related illness, about environmental toxicity, about gut-related health, about immune system, about toxicity, about infections, anything at all is fair game. I always love to do these live Q&As and love to hear from you. Hi, Adam and Michelle from Montana. Awesome. Thank you so much for joining us. So one of the questions that was pre-submitted was tips or tricks. This is a good one. We actually get a lot of this question from our patients or other patients who purchase product at drjillhealth.com at the office, and how to do a supplement schedule. And this is tricky because if a patient comes to see me, I give them a supplement sheet and a recommendation of take this twice a day, take this at bedtime, take this in the morning before you eat, etc. So sometimes it can get really, really tricky to do that. So here's some tips and tricks. I'm going to tell you one thing that I do. I take probably 40 supplements twice a day. I take a lot of things to perform optimally. And what I've learned, this is, there's good, better, best when you're doing supplements or protocols or anything like that. I've decided for me, I do good, maybe even better, but it may not be the best, but it works. So here's tip number one. You can divide all of your supplements 2 or 3 times a day. And as long as there's nothing that will interact like clay or charcoal, there's certain things that are like binders or maybe liposomal products that absolutely cannot be taken with other supplements. But the rest of them, you can take together and put them all in one spot. Like I said, I take everything morning and evening. I just make it very, very simple. I also have another time at bedtime. So anything that can't be with the rest of it, I take at bedtime. And if you're really, really detailed, you might notice that, this mineral shouldn't be taken with this because it'll decrease absorption. Well, this is where the good, better, best comes in, because sometimes it's better just to get them in your body and maybe 80% effectivity than instead of 100%, but at least you took them that day. If you're one of those people who just needs a simple protocol because your life is crazy, and for those of you who just joined, I'm talking about supplements, schedules, how to take your pills, how to make it easy. And I'm sharing what I do, which is not necessarily the best, but I said good, better, best. And sometimes it's just good because you get them in. So what I do is I divide everything twice a day. I take it twice a day, and then I take things at bedtime. And even though there's things that maybe shouldn't be, close to in timing, I figure it's better that I take them than to forget them or have 5 times a day where I miss 2 or 3 times. So that's what I do. Now, again, that's good. That's not better or best. If you are able to regiment and put the liposomal products in the morning or evening away from the rest, usually 30 minutes or 60 minutes before food, that is ideal. I mean, anything liposomal usually has phosphatidylcholine or phosphatidylserine in it. So it increases absorption through the mucosal surfaces. And those tend to be better on an empty stomach or away from other supplements. And ideally, you could do those, when you first wake up. The other caveat is if you have medications, prescription medications, especially thyroid, you do not want to be taking your supplements with your prescription medications unless your doctor says it's okay, because that can really, especially with thyroid, so that'd be levothyroxine or Cytomel or liiodothyronine, any of those thyroid medications, those are really not best taken. And you want to talk to your pharmacist, talk to your doctor. There are some meds that you cannot take with other meds, or they will interfere with absorption. So you want to take into account that. But I find that when you get a supplement schedule where it's 6 times a day or 5 times a day, where you're doing 30 minutes before this meal and 30 minutes after this meal and an hour after this, it's just too hard to do. And for compliance sake, I like to make it easy. So sometimes I compromise the best where you take things every 30 minutes. So you maximize absorption just to get them in. And that's the bottom line there. But if you are able to put the liposomals first, and then typically like something like glutathione, you would follow that with a binder. Liver support, you might follow that with a binder after an hour. Binders are the one exception. This would be clay, charcoal, glycomannan, chlorella. Binders most of the time, except for in the case of like humic and fulvic acids, should be taken away from meals and away from supplements by at least an hour. So I say 1 hour before a meal or 2 hours after meal or supplements. And that way you don't interfere, because binders by nature are statically charged particles and they will bind those minerals if you take them right with your minerals. Now, some people ask about how to take binders, how long, all those things. I'm going to talk about that in just a minute. But I just want to encourage you, pop in, say hello. Hi, Monique. Hi, Nancy. Hello, Tom. And please put your questions in. I'm going to be here for about 30 minutes, maybe slightly longer. And I will be watching on the feed to see your questions. So put them in. This is your chance to talk to me live. Hi, Karen. Awesome. Great to see you. So let's go back to binders. Binders. So binders are, like I said, a charged particle. There are prescription binders as well, like cholestyramine and Welchol. And these are things that will aid your liver and gallbladder when they excrete the bile. It'll bind to the bile acids and help take those toxins out of your body. They're also, especially the prescription ones, many of them used for lowering cholesterol, because cholesterol's place, its home, is in the bile acids. So if you're binding bile acids down, you may decrease cholesterol. That would be one of those contraindications for taking prescription binders if your cholesterol is extremely low, because typically prescription binders will also lower your cholesterol, which is great if you have high or high normal cholesterol. So that's just a little bit about binders. And like I said, it's best to take those when you're making a supplement schedule 1 hour before a meal or 2 hours after. But just to repeat what I said in the beginning, if you're just joining me, when I'm creating a supplement schedule for myself or for my patients, I always err on the side of what makes sense for life, because it gets really tricky if you have 7 times a day, 6 times a day, 5 times a day where you're taking things. And I know with my busy life, I can't do that. So hopefully that helps. If you have any follow-up questions about supplements schedule, Natalie submitted that question. I hopefully have answered that. Okay, I'm jumping right in. And again, put your questions in. I'll get through as many as I can today. And hello to everybody who's joining us. Nancy, you asked about colostrum for gut healing. So what colostrum, whey protein, and bovine immune globulins have in common is they contain immunoglobulins. These are part of our adaptive immune system that creates antibodies to certain things, like to viruses or to bacteria. So sometimes what they can do when you take liposomal colostrum or bovine immune globulins, or when you take even whey protein, they have these immunoglobulins in there. And the studies show that these immunoglobulins that you take orally will passively bind things in the gut that you don't want to be there. So for example, the bacterial coating lipopolysaccharide, bovine immune globulins, and liposomal colostrum will passively bind some of that LPS, which is a big inflammatory trigger for obesity, for diabetes, for heart disease, and for mood disorders, and so many inflammatory conditions. Also, say you have H. pylori, or you have Clostridia, or you have some infection or fungal overgrowth, those bovine immune globulins have also been shown to bind fungal metabolites, viral metabolites, all of those things. So they're very helpful at aiding your gut's immune system to decrease pathogens, and they support your own immune system. So I'm a huge fan. The things about bovine immune globulin you can get at Dr. Jill Health as gut immune powder, and now we have caps. So that is my favorite product. I take it myself. But that product is bovine immune globulin based. You can also get liposomal colostrum at Dr. Jill Health. It's another brand called Sovereign Labs. Love that as well. The thing about liposomal colostrum is it's from dairy. So if you have a real sensitivity to dairy or dairy proteins, you may have a reaction. And then the gut immune powder, gut immune caps at drjillhealth.com do not cause reactions because they are beef or bovine based. So the only problem would be is you were sensitive to bovine sources. So I love that. And Nancy Lynn, another thing about gut healing, you ask about that. One of my new favorites, especially with long COVID or people who have COVID symptoms that are gut related or post-infectious IBS, is butyrate or butyric acid. So you can find that as calmeg-butyrate on my site, drjillhealth.com. And it's a really wonderful healing agent. It's a short chain fatty acid. You can also get that from food if you eat ghee or butter. Hi, Monique. Why can't liposomal be taken with other supplements? So this is a great question because I started our conversation with how to do your supplement schedule and when to do this or that. So liposomal can technically be taken with other supplements, but here's the catch. Liposomal, typically you're going to have a pump, a liquid. Some of them are oral, and it just means that they're made into a capsule, usually a gel cap, that when you get in the stomach, it's very easily absorbed by the cells. The other liposomals that I said are mostly pump. Glutathione often comes as liposomal, and many other things liposomal. And what happens is when you put that under your tongue and you swish for 30 minutes, it's going to go directly into the tissues and not go into the stomach. So technically you could take your supplement shortly after, but I typically put all the liposomals together because those liposomes, those things that create emulsification and enhancement of absorption, they help each other. So all liposomes will actually aid each other in absorption if you take your liposomes together. So that's why I recommend that. But you technically could take your liposomes and 5 or 10 minutes later, you could take something else in your stomach and you'd be just fine. Hi, Tom. Any tips for treating chronic candida besides prescription azoles, that would be like fluconazole, or antifungals? Many thanks. Thank you so much, Tom, for your appreciation for the blogs. Yeah, and if anyone doesn't know, jillcarnahan.com, you can find so much free stuff there for resources. I write a weekly blog, and literally probably almost any topic you could ask me about, if you go there and do a search for Lyme disease or Epstein-Barr virus or long COVID, you're going to find articles on that, mold toxicity, etc. So you can get those. They're free. You can share them with friends and family, and it's all on jillcarnahan.com. So thank you, Tom. So chronic candida. So first of all, we have to understand that candida is an opportunistic infection. We all have some forms of yeast in our body, but the difficulty is when you talk about chronic candida and fungal overgrowth, this is a very real thing. In fact, just this week, I pulled an article on cancer, and they're doing genetic workups for cancers and looking in many, many different forms of cancers and finding fungus in the cancer. Now, that doesn't necessarily mean that the fungus caused the cancer, but what it does mean is that this weakened immune state in cancerous lesions, there's many, many times, I think it was a large percentage, please don't quote me because I don't have it memorized, but there's a very, very large percentage of different types of cancers that contain fungus. Yes, Aspergillus, Candida, and many, many other types. That was kind of mind-blowing, but also not surprising. So back to your question, Tom. Weakened immune system. There's also always a component of a weaker immune system if there's a chronic fungal infection. So you can fight it with all kinds of herbs and things. And until you actually get that immune system helping you out, you may or may not be able to overcome that. In my experience with fungal dysbiosis in the sinuses, in the lungs, in the gut, you need to treat the area. So if it's in the sinuses, you need to do a nasal spray that's antifungal. One of my favorites is citricidal from Nutribiotic, which is a GSE nasal spray. And I often compound nasal sprays with either fluconazole or itraconazole and EDTA because that busts the biofilms and treats the nose. Your treatment would be at least 12 weeks, maybe longer. But for the gut, which is probably what you're talking about, Tom, you want to do something like my Candida Destroyer is one of my favorite. It combines oregano, caprylic acid, and several other herbs. And the dose on that is like 2 or 3 twice a day. Also, you want to start slow, work up, because fungal die-off could be really nasty. If anyone's experienced that, raise your hand, comment. That can be tough. So I like the Candida Destroyer, and usually I will combine different things. A couple other things that you can get from drjillhealth.com are FC-Cidal from Biotics. That's not available commercially, but it's a great product. And if you don't see it online, you can always call our store. There's a few supplements that do not allow us to sell directly online, but we have them. So if you ever wonder if we have it, you can always call the store and check. But Candida Destroyer is my favorite. We also have a Berberine 1000, and that is very effective for Candida as well. And especially if you have bacteria as well as fungal overgrowth, my favorite thing to do is combine Candida Destroyer with Berberine, and those make a great mix. Now, probiotics are key. So what I would do with the probiotics is our Spore plus IG, which is a combination of Spore and the immunoglobulins I was talking about a few minutes ago. That's a great probiotic. And of course, you might have heard of Saccharomyces boulardii. We have one called Sacro Force, 2 per day is a dose. That's a great adjuvant to the antimicrobial herbs. And then you can also get probiotic with Sacro on drjillhealth.com because it kind of combines those. So hopefully that's help. And then, Tom, the other things are diet and lifestyle, right? You want to decrease stress, get your sleep, and you really a low sugar diet or a no sugar diet will not eliminate candida, but you don't want to do a lot of alcohol, sugar, fermented foods. You don't want to do a lot of dried fruit juices, and refined carbs like flours and sugars. You pretty much want to eliminate all those things, because otherwise you feed the yeast, it grows, you kill it, and you're in this terrible battle. Now, the last thing about candida and treating candida is it's very long term. I'm typically treating for 4 to 6 months, not for 4 to 6 weeks, because it takes a while. And while you're doing that, you want to support the immune system so that you can get back on track and not have to fight this forever. Hey, Karen, great to see you. What are you finding helpful for neuroinflammation? So neuroinflammation, just for those of you who don't know, is something that happens in our brains and nervous systems. And of course, just like it sounds, it's inflammation of the nervous system. Neuroinflammation can happen with Alzheimer's, Parkinson's, ALS, some pretty severe diseases, but can also happen when you've had a virus, or you've had a concussion, or you've had Lyme disease, or you've had Bartonella, or you've had Epstein-Barr. And we've even seen with things like early onset dementia that HSV, herpes simplex virus, plays a role. So I believe probably any toxin or any infection could cause neuroinflammation. So of course, with functional medicine, that's a loaded question, because you want to find the root cause and actually treat whether it's Lyme disease, Bartonella, Epstein-Barr, HSV, or a concussion along with an infection or something. But the bottom line question is, what kinds of things do we use to support? So there is so many things I could mention, but some of my favorites are acetyl-L-carnitine. That's one that's particularly good for helping acetylcholine if the brain is foggy, or there is encephalopathy symptoms where, focus, concentration, memory. Just for pure memory, ginkgo is amazing for brain blood flow. So I love ginkgo. Herpesine will block the reuptake of acetylcholine. So I like to use herpesine and acetylcholine together. But just purely anti-inflammatory, if I'm thinking like post-concussion, lion's mane is amazing. It's a mushroom that's really powerful anti-inflammatory after concussion. If I'm thinking other just anti-inflammatories, I really like boswellia. I like curcumin or turmeric. We have one called super turmeric. One of my favorite new ones post-COVID neuroinflammation has been our Cytoblox, CYTOBLOX. It combines Chinese skullcap and bee propolis, and it's kind of a unique formula and really, really good, I find, for mast cell activation. Now, once again, I could spend a whole hour on mast cell activation, but often the mast cells get irritated or triggered from COVID, from Lyme disease, from mold, some of these infections and toxins. And then all of a sudden you have mast cell issues, and mast cell issues, histamine, high or low, can affect brain function and inflammation. And some of my favorite anti-mast cell supplements are Histacyst, which contains quercetin and nettles, or the Cytoblox I just mentioned, CYTOBLOX, or you can also try something like turmeric, curcumin, and boswellia. So those are just a few of them. I also like choline, phosphatidylcholine. Citicoline is one of the brand names for the brain, but phosphatidylcholine, PC, is a huge healer of the brain and inflammation. And then you still want to think about basic detox. So like glutathione, liver support would be helpful as well. Other things like, biohacking things would be maybe red light therapy, like a Violite or a red light sauna. Things like cold water, like plunge. Some of that can be good for the brain. There's so many things. Hydrogen, breathing hydrogen can be helpful. There's just a few, and there's so many things we could be doing. Of course, things like NLP, neuro-linguistic programming, things like EMDR, thought field therapy, brain spotting, any of those somatic behavioral therapies. Because I always find, like, if you have Lyme disease, or you have Epstein-Barr, you have some infection or toxin, maybe you had mold exposure, and then you get a concussion on top of that, it's a way worse situation. So often it's not just the concussion by itself, but it's concussion plus inflammation, infection, or toxin that creates someone who has long-term cognitive difficulties. Hi, Holly. What's your protocol for Babesia when herbal tinctures don't work? Okay, this gets really complex because we get into meds, and there's a lot of meds that can cause harm to the gut. So I'll just give you a few things that can treat Babesia. I don't do protocols, so I will always share with you what I like to use and like how I like to use it. But I have kind of a toolbox that's a lot of things, and I just listen to the patient and then talk to them about options and see what they're sensitive to. And so someone with Babesia, I could treat 10 or 20 different ways, but here's a few pearls. So first thing is Malarone and Mepron are two drugs that are very effective against Babesia, although there is becoming more resistance. So those are two drugs that I use frequently. And often I don't know the last person that's had Babesia by themselves, by itself. Many times there's Borrelia, which is Lyme, with Bartonella, with Babesia. So that's the most common thing that I see. And if that's the case, then I would use something like triple intracellular therapy if we're talking meds, and that would be either doxycycline or zithromax or clarithromycin with rifampin or rifabutin with Mepron or Malarone. Those are kind of the three layers of the triple intracellular, and that can work very effectively. Another regimen could be doxycycline or clarithromycin with zithromax and possibly rifampin or rifabutin. But again, this is absolutely under a doctor's supervision because these are heavy hitter drugs, and they can cause some damage if you're not protecting the gut. I also really like, you might have heard, if you haven't seen my podcast with Teresa Haller, it's amazing. I learned so much. She's a PA who treats a lot of Lyme disease. You can find all my old podcasts at YouTube under my channel, or on iTunes if you just search Dr. Jill Live, Teresa Haller. I don't know what episode it is, but lots of good tips. And one of the things we talked about there was the new Nutramedix formulas. So they have combined some of these things. Nutramedix is a company that's been around a long time and has products that treat Lyme disease, Babesia, et cetera. I really like this company and they work well, although I do use other products as well. But I wanted to mention this because your question on Babesia, they have a BRL. It's called Nutra BRL for Borrelia. They have a Nutra BRT for Bartonella, and they have a Nutra BBS for Babesia. And these are the best three herbs combined into one tincture. I love these formulas. I'm a huge fan. They're hard to get, but you can get them at drjillhealth.com if you can't find them elsewhere. And the thing about these is it's 3 tinctures combined. So you're dosing, if you've ever done any other tinctures where you do like 8 or 10 or 30 drops twice a day, with these new combined tinctures that I just mentioned, you do want to use more like 2-dropperfuls 3 times a day, a much higher dose. But as always with these, you go very slow. So Holly, that's just a snippet, but I hope that gives you a few pearls on kind of how to treat it. Other things that have been studied for all of the tick-borne infections, and especially Lyme, but work for Babesia, are Cryptolepis and Japanese knotweed. And we have both of those. I have my own brand of Cryptolepis because it's been so important to have for these tick-borne infections. Once again, I say respect Cryptolepis because it's a powerful medication. So start with very tiny drop doses, like 1 or 2 drops, and work up. I was just going to say there's so many things you can do, but those I really like for herbs. And then I mentioned the Nutramedix. Oh, I know what I was going to say. If you are following here or listening on YouTube or iTunes, wherever you hear this, I will be sure and leave links. I'll come back and put links into some of these things I'm mentioning. So if you can't find them, you'll know what they are. Hi, Nancy. Let's see, any advice for LS in women and kids? I'm guessing you mean lichen sclerosus. I don't know for sure if I'm picking the wrong acronym. You let me know. There's a couple things that could be LS, but that's the most common. And there may be something else you're thinking of. Lichen sclerosus is a change in the skin, and usually fungal related or immune system related. It's very similar in mechanism to psoriasis. So usually I'll go with the gut, treat the gut, do probiotics, do gut healing things like we talked about, bovine immune globulins or butyric acid supplements like CalMag butyrate, sodium butyrate. And then I would also treat any bacterial or fungal overgrowth in the gut. Hey, Jessica, so good to see you as well. Severe histamine intolerance since getting COVID. Oh, I'm so sorry. This is so common. It's like the COVID virus really activates mast cells. And so people often post-COVID, we're seeing just huge increase in mast cell activation and mast cell symptoms. Acid reflux and heartburn. Now, if you didn't know, clearly Jessica does because she's sharing this with us. That's a very common symptom of histamine intolerance. So what I would do, Jessica, is I would start with your H1 blockers, your H2 blockers, your mast cell stabilizers. So a protocol, something like Zyrtec, Pepcid, and then maybe Montelukast or Ketotifen. Those would be kind of the order of things. What might give you short-term relief is something like our DGL Plus, or the Cytoblocks I mentioned earlier is wonderful for mast cells, and so is Hist Assist. Those 2 products are my favorites. I always start naturally with Hist Assist, and then I add Cytoblocks. Again, drjillhealth.com, you can find those. The Hist Assist is just like it sounds, HIST, ASSITIST, and then the Cytoblocks, CYTOBLOX. and those are great. And then prescriptions, you can do any sort of antihistamine, Benadryl, Claritin, Zyrtec, Allegra, Xyzal, and the Pepcid, which is ranitidine generic. And then you can add Montelukast or Singulair and Ketotifen. And again, you kind of sometimes have to layer. Now, if it gets really bad with mast cells, sometimes you need steroids, sometimes you need immune modulating drugs. I try to avoid those, but I've had some pretty severe cases where those are needed. Oh, and you're also asking SIBO, candida. So often you can have a little bit of gastroparesis, which makes the heartburn worse. Now, interestingly, Jessica, come back on Tuesday, next Tuesday. You can check this page for the exact time. I think it's 3:30 Mountain. I'm going to be interviewing one of my favorite people, Dr. Louis Sandberg, and he is an expert on all things SIBO. And we're talking specifically for the whole hour about GERD and what to do. And he's full of tips and tricks and natural treatments. He's a naturopath. So please come back and see that interview on Tuesday with Dr. Sandberg Lewis. And that'll be recorded if you miss it. And you can check that out on my YouTube channel or here. Hi, Diane. Could you please talk about the best test to take for mold toxicity? I've answered this before, and it's always a great question to talk about again, because if I could just say, okay, here's one test for mold, wouldn't that be easy? And sadly, it's not. So what I typically recommend is you do a symptom survey first. And if you don't know what symptoms are, if you go to my blog, jillcarnahan.com, you can just search for mold. And there's one of my first articles, probably in 2015 or 16, on mold that talks about the symptom list. You can see how much of that fits. Maybe do a timeline to see when the symptoms started and if they started with a change in environment. And then you can also do visual contrast testing online, VCS testing, freebcs.com and survivingmold.com both have those tests online. We do them in our office. So those are some screening things. Otherwise, you can do urinary mycotoxins. There's 3 labs that do that, real-time labs, Great Plains and Vibrant. I use them all for different reasons, and they will test your urine for mycotoxins. That would need to be ordered by a doctor, but that's a way to do that. However, this is really important. Just because you have mycotoxins in your urine does not mean you have a current exposure, because this is excretion. So it means that it's measuring excretion. And sometimes you get out of a moldy home or you move on and you are still excreting mycotoxins as you detox. So just because the urine mycotoxins are positive, you need to put it into context of your situation and where you're at, and if you think there's still exposure. One of the best ways is to do a qPCR or ERMI test in your home to see if there's dust in your home that contains mold. And then, of course, you can do the Sears labs from Dr. Shoemaker, which are MMP9, TGF-beta, MSH, ADH and osmolality, and there's a few others. Those are the main ones, and see if they're abnormal. I know it's a lot, but it's complex. Okay, Sandy, you asked about candida and oral thrush. One other tip for that, I went over that for Tom a few minutes ago, but one other tip for that would be you can get a compounded swish and swallow of nystatin, or you can use coconut oil as oil pulling, and those things can all help with thrush as well. Hi, John. Severe inflammation, mass on kidney, and large spleen. Could this be caused by mycotoxins? First of all, I'm so sorry. And all of you out there who are suffering from different things, I just want to pause and say, life is hard, and it's hard when you're sick and you're not feeling well. And especially when you're in the realm of complex and chronic illness, and maybe your doctor doesn't quite know what to do or says everything's fine, and you know that's not true. I just want to pause and say, I feel you. I've been there. And hang in there, because there's always hope and there's always answers. And so you're asking about, could this mass be related to mycotoxins? So mycotoxins are funny because they can do almost anything to any system. I've seen them weaken immune system, and things like old Lyme pop up or cancer pop up. Masses in general, like lipomas, especially benign masses, lipomas and growths and things like that. Bartonella has a predisposition towards causing weird growths and things in the body. So sometimes that can do that. Mold itself could, like I said, could do almost anything. It's not typically that I would think that mold would cause masses, but again, anything's possible, and that's absolutely plausible. It's just not real common. Hi, Terry. Oh, you're living in toxic mold. I'm so sorry. And your husband says everything is okay. Support needed. First of all, just sending you love, and I wish I could give you a hug. I'm sorry. It's so hard when you live with a spouse or a partner or a child or a parent or someone who denies your reality. We call that gaslighting. And it's really, really hard when you're sick and you know something's wrong and you want to do something about it, but because of household situations or loved ones or whatever it is that you can't really do what you need. What I would say is do whatever you can to empower yourself. Whether it's creating a safe spot in your bedroom with air filters and opening windows, or it's just really hard because obviously you can't always make these decisions alone when you're in a partnership. But I also understand it's really, really difficult. I wish I could give you an easy answer, and there's not. I will say this, there's many, many people that are in your situation. So it doesn't make it any easier or any better, Terry, but you are not alone. And I'm sorry that you have to go through that. It's funny, I don't know if I've talked about this yet on live or Q&A, but just a few months ago, I found Chitomium, the worst of the worst, in my kitchen, just right behind me. And I was actually having a lot of symptoms. I was having brain fog and fatigue, and I knew something was going on, but I didn't know what. Turned out my neighbor's fridge leaked and caused some mold growth. And here I am, someone who's so careful and knowledgeable about mold, and I ended up being in mold. And now that it's remediated, I feel 100% better, and it's all gone. But it was tough. And here I am again, trying to do the right thing. What I will say, here's the tip of the day on this Q&A. I highly recommend you disconnect the water line. I'm gonna say that again. Here's the tip of the day. I highly recommend you disconnect the water line on your fridge. You can make ice cubes other ways. I know it's a little less convenient, but I've seen too many situations, including a situation here in my own condo where there was a water leak from a fridge that caused severe mold, and it's behind the fridge. You don't see it. It goes under the floor. You don't know about it. So it's a very common hidden cause of mold growth. So if you're allergic to mold, disconnect the water line from your fridge. You can make ice cubes another way. What I do is I have my clearly filtered pitcher and I pour that into ice cube trays, and I just do it the old fashioned way. Hi, Misty. What do you recommend for heart palpitations? Well, that's a little complicated because there's so many causes of heart palpitations. What I'll do is I'll say this. First of all, try to find the root cause. It could be infection. It could be toxic mold. It could be Lyme disease, Bartonella. It could be many, many things, pericarditis. So check those out first. But if you want to know the nutrients that could stabilize a heart, there's 4 that are key. One is L-carnitine. One is CoQ10. One is taurine, and another is magnesium. I had a friend just the other day who complained of heart palpitations. I put her on magnesium and it's 80% better. And that's it. That's all we did. So all of us, I would say most all of us, are very deficient in magnesium. So you can assume that you probably need magnesium. My favorite one is our Super Mag because it's a chelated combination of multiple magnesiums in one. Very inexpensive. Take 2 caps at bedtime, and that might be a good way to start. Now, I should say this at the beginning, I'm not giving you medical advice. So please talk to your doctor. Don't take anything I say as direct medical advice, but I always want to give you as much information as possible here. So I'm being very open and transparent. Hi, Judy. Having a hard time finding out whether remediation is necessary for cross-contamination. Okay. And I'm going to do 1 or 2 more. And then this is a really good question though, Judy. So what to do? Do we throw out our stuff? Is it cross-contaminated? Well, I just got done telling you, I just had a massive Chitomium here in my kitchen and I remediated and I'm fine. And I didn't move out and I didn't give away everything I owned. But here's the idea. Before you do the remediation, you probably want to have an inspector or yourself test, not for mold, but for mycotoxins. You can do this through an EMA test from real-time labs and test for mycotoxins. A remediator can do that as well to see if there's the products of mold in your clothing, in your environment. Then you have a professional come in, they seal it off, they contain the area, they vent it outside, and then they put air scrubbers in that area where they're remediating, and they take out all the contaminated material safely, carefully, while they're contained in your home. So they tear out the drywall, whatever, under containment. And before they take down that containment, they need to retest in that containment to make sure there's no mold in the air. So air sampling is fine. Because if that containment, inside that containment has mold, they have not done their job. And a good remediator will do this. If that is free the next day of mycotoxins and mold in that containment, then they can take down containment. And if your results for mycotoxins in your house come back as elevated, you do need to do a fog and a small particulate clean after the remediation. And that will generally clean a lot of your things, a lot of the particulate off surfaces and that. And then for clothing and stuff, you can wash those. One of my favorite things is EO by Microbial Balance Products. that you can find on my page called Products We Love. Just go to jillcarnahan.com. Under online store, you'll see Products We Love. And there's all those favorite things, and that antimicrobial for your laundry is there and works really, really well. So those are just a couple tips and tricks. Okay, I think I'll do one more question. We talked about histamine tolerance, and gosh, you guys, a lot of you are suffering. Tiffany, Jessica, you're welcome. Emma, let's end with this one. Oh my gosh, I have 18 more here. So I'm going to try to come back soon and answer more of your questions. How to treat colonization in the gut. This is a great question from Emma. And really common. So one of the things I see for failure in patients to get well from mold is, so they may go through getting their home cleaned and then treating with detox like glutathione, liver essentials, some of those binders. We have a new binder called Zeobind Plus. Love it. One of my new favorites, along with charcoal. And you can use those to detox the body, aid the process of bile acids being excreted, and then the binders will grab those and pull them out, and it works really well. But what you're asking about, Emma, is if there's colonization, and you're mentioning the gut, but it can also be lungs or sinuses, any cavity in your body. And this is one of those things that's a common reason for failure of treatment success when there's still colonization. So what to do? So typically I would treat with antifungal medications for the gut, and depending on what I see, fluconazole is better for candida, and itraconazole, voriconazole are better for aspergillus if there truly is aspergillus in your gut. Same thing with sinuses. You want to do a nasal spray if needed. I mentioned that earlier. GSC is a good option. Colloidal silver is fantastic antimicrobial. I don't find it's quite as good for mold, so I often compound a fluconazole or itraconazole nasal spray to clear out the sinuses, and that can be really helpful. Thank you, Teresa. So good to see you here. So much love to you. Hi, Lisa. Oh, thank you for your kind words. Oh, and Jessica's back to, we'll end on this note. So I think Jessica asked about histamine intolerance, and I gave a lot of solutions, and they are kind of band-aids. She said, what about root cause? So mast cells are normal parts of the immune system that are reacting to a threat. The most common threat is Lyme disease, mold, and now COVID. Those are the top three, although there's many others: heat and cold and pressure and vibration, and you name it, foods, different things can trigger histamine responses. But one of the most important things that we need to do to go to root cause is find what is triggering those mast cells. And if it's long COVID, then you want to try to calm that immune system and treat the underlying infection. Of course, long COVID nowadays, we know that it's no longer a viral infection. It's just that revved up immune system. And Jessica, the bottom line is it's tough. Some people are real prone to mast cell activation. I was for years. I grew up with horrible allergies, horrible rashes. My whole life, I had to avoid histamine-containing foods. The good news is, years and years later, I'm in my 40s, and I've done mold detox. I avoid mold for the most part, and done a lot of work, and I have a lot better tolerance. I don't have heartburn. I don't have symptoms nearly as much. So it is possible to decrease that mast cell activation, but it's tough and it takes time. Gosh, guys, I am enjoying this so much. I hope you are enjoying it as well. Thank you so much for stopping by, for taking the time, for sharing your encouragement, for sharing your questions. I promise I'll be back soon. But for today, I'm going to say goodbye, get on another interview, and I wish you all well. And just remember, you're not alone. There is a lot of people sick out there, and I know sometimes it feels like you're all alone, but there's hope. There are answers, and you are not alone. Thanks so much for joining me. We'll talk soon.